Hi, what the HealthTech listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice across health and social care. This week, I'm speaking to Anne-Marie Perry, who is the founder of CareMatch. With over 30 years of experience, she launched CareMatch with the aim of answering one critical question in an ever-evolving industry. What makes great care? This is a subject we're all incredibly passionate about, so I'm so excited to talk to her today about this and a lot more. Anne-Marie, welcome to the podcast.
Thank you, Justine. It's really nice to be here. Thank you.
Now, there's so much, when I was looking at doing a bit of research for this, there's so much that I could chat to you about. So can we start with the fact that you founded CareMatch in 2017 with the idea of delivering care differently? So what does CareMatch do and how are you different to other home care providers?
Well, we're different because I started with an ethos, and we'll talk about this a bit later, but I started with the ethos that I needed to give the carers more. I needed to drive up quality and I need to keep the charges the same. And so I had to find a way of doing that. And actually, I've been in care for 37 years, which is a really long time. But whenever I've sat with carers, they're the ones who know the clients the best. So that's where I started and thought, if the carers know the clients the best, surely they should be the ones that are driving the care, because they know what outcomes a client might, or care receiver we call them, might want to achieve. They know how the client is feeling on that day, and then they will know how best to deliver that. So the difference with CareMatch, when we start care, any of us in the care world, we all want to make a difference. That's it. We don't start this job trying to do it badly. We genuinely don't. The main difference about CareMatch is the carers have complete autonomy. The relationship is between the care receiver and the caregiver, and they drive the care journey. So they're the ones that decide what the care receiver decides what they need. The caregiver says, okay, I can give it to you in this way at these times. There's a lot of flexibility and cooperation and collaboration. And so the main difference, self-managed teams of carers who deliver to the vulnerable in their own community without any management infrastructure at all.
That point you made about, the caregivers knowing the care receivers more than anyone. It almost seems like such a straightforward thing that I think people forget about. It's, of course they're going to know their care receivers much better than anyone else. So hopefully that makes a big difference to what care they get.
That's absolutely true. There's often a disconnect though with family members, because if you have an elderly parent, for example, who's dementing, the care receivers will deal with what's being presented today, knowing what they do about dementia and the skills that they have. The family member might be remembering their parent as a young, active, or younger, active, very involved individual who did a lot in their community. And there's sometimes a disconnect between the carer saying, but actually mum won't want to do that, and the client saying, or the advocate, we call the family members or the people who are engaged with their elderly relatives or children, the advocates, they will believe that they know best, and sometimes they do, they genuinely do, but they will sometimes try and get the carer to deliver to the person that they knew previously, which might not be the right thing. So it's a very delicate, and we appreciate it's a really delicate balance, but the carers do too.
Yeah, it must be a really difficult sometimes difficult conversation and things like that to have as well when you're sort of the professional.
Yeah.
Versus the family member, which is obviously someone that's incredibly close to the care receiver as well.
So that's, you asked what do we do differently. So that's really a key part of what we do. We build communities of carers. So you might have a community of 20 or so carers that all work together to deliver the vulnerable in their area. And we develop what we call a care hub around every care receiver. So that's 4 or 5 carers who just know everything about the care receiver, all the nuances. But it's, as you just said, Justine, it's very simple stuff. It's just when I go into the house, Do I know where the coffee is? Do I know how they like their coffee? Do I need to read the care plan? No, I don't, because I actually did the call last night, and so I know where they are in their care journey. So by having 4 or 5 dedicated care members in a care hub, you've got a very continuous delivery, actually, of care. Having the community for the caregivers, you've got the support. And that's really key. Carers' biggest complaint, wages. And I think we've addressed that because the carers get more. The second one is not feeling valued. Now, I run a domiciliary care business, so I run a very traditional care business as well. And we do a lot to try and make carers feel valued. You know, we have all sorts of communication channel, just a massive amount, awards, all sorts of things. But you know, the thing that they feel valued most about is when they get the smile at the end of the day or the end of the call from that elderly person. So in CareMatch, that value piece comes from the relative and the care receiver, which is the most valuable place for it to come from. So the care, that's sort of blown away that myth of not feeling valued, because you get your value from your care receiver and your advocates, your family.
Yeah, we've spoken numerous times on the podcast within previous episodes about people that go into the world of a social care, and that people go into it, it's more of a vocation, and the people that do go into it really do want to make that difference and feel that value. And just that point you mentioned about, you know, kind of knowing you've done a good job for that care receiver is, I can imagine, makes you feel incredibly proud.
Yeah, they just look lovely and they're smiling when you, or they're not actually, but you know that they're not going to smile anyway. That's fine, because again, the carers really know them. And I've got 1 or 2 carers that say, you know, I really like the grumpy old ladies. Give them to me, because I just love the feistiness. And you think, great, and that's a really good match.
Yeah, definitely. I mean, I'm going to skip forward a couple of questions because you've mentioned about community and hub and your care hubs. So I just want to touch on, you know, that having a feeling of community is such an important part of life for your staff, and especially for older people as well that might be living in their own homes. Obviously, you've mentioned your care hubs. Can you tell us a bit more about what they actually involve?
Yes. Can I just wind back a little bit? So community is completely valuable, and actually, one good thing that came out of COVID was the value of community. You know, we saw WhatsApp groups and we saw charities and we saw lots of just sort of splinter groups, didn't we, set up and start looking after anyone that might need help in their community. And that really accelerated the CareMatch ethos, if you like. So that community piece is really key for us because it provides a support infrastructure for all of the carers. Your question was, can I explain a bit more about the care hubs? Is that right? So we have a community, say, of 15 to 20 carers in an area, and they are the designated carers for that area, and they'll have a variety of skill sets and can work a variety of different times, and have a variety of hobbies and interests, and also so a really eclectic mix of people. And then you'll have a care receiver who, well, actually their advocate, their family member, who'll be looking for care. So they'll go online and say, I'm looking for care. And they'll say, you know, mum used to ride, is a smoker, has pets, and has COPD. Okay. So you would want in her care hub, ideally a carer who's got experience of COPD, but definitely carers who've agreed to work with smokers and pets. But you will get a selection of 10 carers, all who will be able to do this job well based on what you've said your mum's needs are. And the top 1, if you're lucky, will have COPD experience, because not everyone will have. But certainly the top 5 or 6 will have said, look, we're happy to work with pets and smokers. And, you know, you'll try and match the hobbies as well. Ideally, you need to find carers that are closest to you, because that means that the carers are spending more time delivering care and less time in the car. So that's a real, and also with just green objectives and carbon emissions going forward, that's a really valuable thing to be promoting now. So you'll get a list of 10 carers, and you and we tell you pick 4. One won't do it, because if you think you've got to have 3 calls covered a day, 7 days a week, one carer can't physically do that. They've got to have some downtime. So pick 2 or 3, and then pick a 4th for when everyone's sick and that awful day when no one can do it. So the 4th and 5th carers who might not come in so often, they might do every other Saturday or something like that, but they'll still understand the client. So that creates that dedicated care team, or called the Care Hub. Family members are also in that Care Hub. So, for example, we had a Care Hub where we had family members who weren't really sure mum was getting the care that she needed, and they were really worried about it. And that's because they lived in Canada. So they had no idea of what was going on. And they're in the Care Hub now, and they see photos of what mum's doing, and they completely interactive in the care journey. So everything that the carers do, everyone in the Care Hub knows about it. So suddenly these family members went from serial complainers in that I had a call from them every day to never hearing from them again, because they're so happy with what's happening. And that's just the beauty of the hub. It keeps everyone involved, and everyone can have their say. Mum hates it when you make her coffee that strong. Can you please make it and it's very simple stuff, Justine. It's very simple, but that's the stuff that if we get right, it makes everyone's life so much easier.
Oh yeah, I mean, there's nothing worse than somebody making you a tea or a coffee and it's nothing how you like it.
Well, that's exactly right. And just another point about that community piece is, again, COVID, 1 million people came to the fore, didn't they, to help their communities. And you're just thinking, our industry is 160,000 light. So I only need 16% of those people, those volunteers that came to the fore, to change the world in care in England, or in the UK actually. That has to be possible, doesn't it? And these are all people with the right values who want to make a difference. So that's what we're trying to do when we're trying to engage those people. And you're right when you said the care receivers feeling part of a community is really important. 3 key reasons for hospitalization: isolation, poor nutrition, and poor meds handling. Isolation should not be a thing, so we can easily challenge that, I think.
Yeah, it's really interesting you mentioned that. In fact, in one of the very first podcasts we did, we spoke to Big Ian Donachie, and he made a really good point about, years and years ago, people used to live in obviously terraced houses with sort of smaller walls and smaller fences, and it was such a natural thing that you'd go out in your garden and you'd chat to your neighbours over the wall, and that interaction, that community feel. And now it's not really as much of a big thing. And then like you mentioned, COVID, it sort of came back a little bit. And I think, just having that, being able to, say hi to your next door neighbour, to smile at them, to, ask how their day is, sometimes that makes somebody feel so much better. And I just think it's such a nice thing to do.
Look, I live in a road where my husband and I lowered the average age limit by about 20 years. So that gives you an idea of how old our road is, or our cul-de-sac. So I can do 4 care calls on the way to work and 4 on the way back. And my family would never notice the difference, because I'd just leave maybe an hour earlier and I'd be home an hour later, but it wouldn't impact on my family or my life at all. But it impacts on theirs. And I was round the other day, and one of my old ladies in my road, she needed her chimney swept. I've never swept a chimney in my life, but we got there and we did it. And she was skipping to the door. She was so happy that it was so easy, it was fun.
Yeah, and it's knowing that impact you've had on somebody's day as well, which is lovely. There's a really nice quote on your website, what you said about, so great care starts with the team who provides the service. We are striving for a delivery where we reduce stress and anxiety for both carers and clients. All members work together to achieve outcomes and deliver what the clients need to live as independently as possible in their own home. So, we hear a lot about how fundamental a great team is and how this strengthens relationships with clients. We've sort of touched on it already in the podcast today. How do you ensure you've got the right team in place to be able to deliver that care that you really want to achieve?
So we might not have that perfect yet, but we have several communities and they're zinging, and it's really around value-based recruitment. So it's about people, it's those that million volunteers that came to the fore. It's those people that have the right values, that want to make a difference, that want to help. And actually, if you look at society today, it's looking at trying to do much more for both the planet and its community than perhaps it was. We're in a very different place than we were maybe 10 or 15 or 20 years ago, which is great actually for care. So we absolutely look at that value piece, and we have a set of scenario cards that we give out when people come to talk to us. And so, for example, you might get if you came to say, I'm looking to do care, you might get a scenario card that says, what would you do if your client wasn't home? And the person who says, oh, I'd go on to the next call, you think, okay, you might not have this right. The person who says, well, I'd put my hand, open the letterbox and shout through that, and I'd knock on the neighbour's door and I'd call the family. So they're the person with the right values that understands the importance of what they're doing. So, and we've got 20 or 30 of these value cards, but those set our procedures, and we don't have a hierarchy. It's really, it's a very flat system, and everyone has a say and a view, and the carers, as we've said before, will generally know the care receivers better or best. And so we listen to them, and then we say, okay, but from a legislative point of view, this needs to be handled. So how do we do that? And so it's a very cooperative and collaborative approach, and it's amazing. And interesting, our probably most successful community has got carers that didn't start life in care. So they haven't been phased by the very traditional domiciliary care provider, where you are in fear of legislation every day, and you're very cautious. You have to be cautious, but the risks are no different. It's a lone worker in somebody's house who has to make a decision about the care that they're delivering. And as long as you've got the training and you've got the support, that's the key, the support which comes from the community, then you're free to do, the best for the client. And we within a community, we have what we call a coach, and we have a community champion. And so the coach is the person who absolutely, so they do have a lot of knowledge around care. So, for example, something that might happen in caregivers' life is they make a mistake with the medication. So, for example, they might give a tablet 4 hours in between instead of 6 hours between tablets. Yeah. Now, that's a mistake, and is taken really seriously in social care. So in our world, in CareMatch, what the carer would do is they go to phone the coach and they go, I've made an error with the meds. And the coach will say, okay, so what have you done about it? Well, I've called the GP. And what did they say? They said, well, look, monitor the client, and there's nothing really untoward that's going to happen. What else have you done? I phoned the pharmacy, and there are no contraindications. So they've said, again, just monitor the client and check. Right, you've posted it in the care hub, so everyone knows, everyone knows that this has happened. It's a genuine error. People make mistakes. Maybe come back and review your training, because your training is in date, because it has to be in order for you to deliver care. So come back, review your training, do it again. You do now understand the importance of what you're doing. The system will actually also now notify you and say, look, you can't give this now, you should be waiting. So that's where our technology helps, obviously.
Yeah, no, I think that sounds great, and you've clearly got a great team in place within the hubs. So giving people the chance to live in their own homes for longer is something, to get that feeling of independence. It's so important to so many people. Where did the passion come from you to provide that best quality of care that you can?
Oh, that's easy. I set out to change the world. Long time ago, 37 years ago, and everyone starts, they've got an elderly parent and they want the best for them, and you've got to find care and all those things. I actually ran a care home prior to doing this, prior to doing my dom care business, and that was is very difficult, because we have a lot of constraints from the regulators, who I don't find are the most proactive. So I find them a bit more of a hindrance than a help, to be honest. It all started, actually, I thought, as I said at the beginning, I wanted to give more to the carers, I wanted to improve quality, and I needed to keep the prices the same. So, and I believed that technology could help. And actually, I was in London with my daughter. This is 7-8 years ago, and she said, "Oh, Mum, let's get a taxi." So I'm thinking black cab. I'll hail a black cab. She says, "No, Mum, we'll get an Uber." Oh, what's that? And she says, "You need to download the app, Mum." But basically, it's a taxi. It's a driver who's closest, who's free. Now, at that time, in my other business, we had 15 offices, 15,000 hours, and I'd had 3 managers who were just really struggling. So we'd taken over centrally doing their rotas. So I was doing rotas in West Sussex, Chichester, in Horsham, and in Basingstoke. And there was a half-hour call in Basingstoke I just could not cover. I'd stretched everything. Everyone was working that could be working. There was just nothing more that I could do. And I ended up bringing a carer from Wales, just for a half-hour call, putting them up in a B&B, it for the weekend. It was ridiculous. What clinched it for me was on the Monday when I went into the office, one of the girls in the office said, "Do you know, Anne-Marie, there were 2 carers. They don't work for us, but they were free, and they know care, obviously, and all those sort of things. They'd have done it." Now, not ideal for the client because they wouldn't have known the carers, but it would have been safe.
Yeah.
And I wouldn't have had to bring someone all the way down from Wales and spend a weekend. So that's when CareMatch was born in my head. So I wanted to find the carers that were free, the best solution, and create a community that looked after itself. And here we are.
Fantastic. Again, you've brought me really, really nicely onto my next question because it's about technology and innovation. So you've received CareMatch has received industry recognition for an innovative approach to care. And you also recently spoke at Langbusson's Innovation of Care conference in Birmingham. So why is innovation such a key part of providing great care? And how important do you think it is that we continue to find and share the latest innovations that can help?
Oh, there is so much more to do we have just scratched the surface. So in domiciliary care, technology has been around for a while. It's slightly different from tech that maybe the youngsters will think of, and sensors, etc., etc. But in domiciliary care, technology, rostering, care planning has been around for a long while. Has improved dramatically over the last 5 years because people have begun to understand a bit better. Having said all of that, when the idea of CareMatch was born, I got a CTO, a Chief Technical Officer, and he looked at everything that was out there in the marketplace, and to see if there was something we could use that existed already. And there wasn't, interestingly. And that's because we wanted to give the power to the people. So we wanted the carers to own it. We wanted to engage family members and make sure that the family members were an integral part of that care journey. They didn't sit in a portal watching what was going on. They absolutely interacted. In fact, they can cover the calls, that's fine. So I believe that was a good way to go. And then often you'll find the tech platform. We've had people sell us tech in my other business, and you'll say, where's the body map? Because you need a body map for marking wounds or pressure area care or anything like that. And they'll go, oh, well, we've decided you don't need a body map. And I sit aghast and I go, but the poor carers, what do they do when they get somebody who comes home, or they start a package and there are 3 red marks that will turn into a pressure sore, and they can't tell you that they can tell you, but they can't mark them where they've seen it. You need body maps. And interestingly enough, they now have body maps, by the way. But the point there is it's techies have decided what the world needs. Now, our advantage, I believe, with CareMatch is we are carers that have worked in the industry for many, many moons. So we know what we want, and we've gone to the tech world and said, this is what we want. And in fact, I just came off a call with our developers, and they were going, look, this is a really good screen. I was going, no, it's hopeless. I can't see I can't see what's on my day. And they were going, no, but you can scroll. I said, well, missed calls. I don't want that. I want to see as a carer what I've got for the whole day. So it's again simple stuff, but we believe, rightly or wrongly, what the gotchas are, and therefore we should start to mitigate those now.
Yeah, it's the collaboration, isn't it? I mean, something that we pride ourselves on at Radar Healthcare is the flexibility of our system, because you mentioned body maps, for example. Everybody wants sort of slightly different things. And, that's why we have a solution that basically people can make, create how they want it to work. But it's about working in collaboration with
Always.
our partners to make sure it does work for what they need it to.
Yeah, always.
So you're also involved with Abbey Care, who since the start of COVID set up care hotels to support local provision. Can you tell me a little bit more about these and how you work with the NHS to provide active solutions to help ease the pressures?
Yeah, so I mentioned earlier I used to run a care home, and we got a request March 2020 to say, could we put domiciliary carers into a care hotel and do visits in the care hotel? So that was with a local authority that we used to work for anyway. So we said, yes, we can, but actually don't use domiciliary care workers, use live-in carers, because COVID, at the very start of COVID, we didn't know the risks of cross-infection. We didn't want to start bringing people from external in and all of those things. So we said, put live-in carers in the hotel and then they can do the visits. But actually we changed that very quickly and just said, put live-in carers in the hotel and run it as live-in care in a hotel setting, and let's engage the community. Because once it's been tested and remains COVID-free for X number of days, then you could release the community effectively to integrate with itself. Yeah. Mm-hmm. So and because I had come originally from a care home, I just knew all the policies and procedures that we needed to make sure we covered off things like clinical waste and just all that stuff. We had a knowledge. So suddenly we have knowledge of live-in care, we had knowledge of care homes, and we put those two together to create the care hotel. We spoke to our inspectors, and it was very, very new and they didn't really know what to say, but we said, look, we've done a policy and procedure manual. So we wrote a full manual. We found 100 carers in 10 days, wrote full manuals, and worked so closely with the NHS. It was the most refreshing 10 days of my life, I have to tell you. It was lovely because we all sat in a room and said, right, we wrote the policies and procedures and we set up the processes, and it was amazing. And we started to make a difference in that people could be discharged from hospital to another setting to create space in the hospital. So word got out effectively, and we did 20, I think, in the end. And we were good at finding carers, good at training people, the carers when they came in. So we always put them in, trained them before the care hotel opened to patients, and then delivered the care. So and it was written into the NHS processes as a BCP for any sort of pandemics or challenging situations where the hospitals are challenged, and it works. And the beauty of the care hotels is you can switch them on and off. So as I said, we found 100 carers in 10 days. We set up 20 care hotels. It's a lot of work, but
I can imagine.
But we're still here and still smiling. Yeah. Very grey, but other than that, and it is great. And now we've got cohorts of staff that just say in the winters, are you doing any care hotels? We'll go yes, and they'll say, pick me. So we've created this very different world where the carers come to us now and say, we'll come and work for you, which is just amazing. So we're currently doing 2 care hotels still.
I mean, that's incredible to have carers coming to you as well. That's just a testament to obviously the type of business and company that you've helped create, I think, and going back to that value bit and people wanting to make a difference, which is just incredible.
Yeah, they are actually good fun as well. I think you need fun in your work life in order to enjoy it, obviously.
I agree.
And domiciliary care has a really bad press, unfortunately, and the culture's not great, and the people don't feel valued. So CareMatch absolutely tried to change all that, and I believe we're doing that. Care hotels, traditional domiciliary care, well, slightly out the box domiciliary care, and again, achieved it. People love doing it, which is just perfect. It means it's a success.
Yeah, definitely. So what about in the future when it comes to care and how people are looked after in later life? What would you like to see happen in the next 5-10 years?
I don't think what I would like to see will actually ever. But what I think will happen, I mean, we've got a problem. We've got the aging population is increasing, the care workforce is decreasing, and there's never enough money. So how do you square that circle? How do you square that circle? And I think the only way I believe that you can do that is, I think we already in domiciliary care and care homes, actually, we're seeing more and more complex people come through. And therefore, in the time that I've been in domiciliary care, that the skill set of the workforce has had to change dramatically over the last 15, 17 years. And before, we used to say, do you want to do care? Yes, I do. Oh, lovely. Off you go then. And we thought, well, we'll give them a bit of training. But it was really 20 years ago in domiciliary care, it was about you go out and you help a little old lady, give them lunch and tea, and it's a lovely life. That's just not the case now. You have such complex needs. Our carers are a very skilled profession. So I think actually traditional domiciliary care will become more healthcare at home, and we'll upskill the workforce. We need to, because the NHS is crumbling. I would like to see the NHS recognise that investment in social care will help the NHS budget. We spoke about poor meds, isolation, poor food. If you tackle those three things and also have some predictive technology around falls, which exists and you can do really easily, we can ease the NHS budget in social care dramatically. But they don't recognise that. So the investment never comes from NHS or government. If you look at the billions of pounds that were awarded, they said to social care, but it's going to go to the NHS first, by the way. And you think, you need to recognise the value of social care to help the NHS budgets. And I don't think we're there yet. So I'd like to see that change.
Yeah, that makes perfect sense.
Oh, sorry, just on that, Justine, and sorry, one more thing. And then the likes of CareMatch, so those self-managed teams, they should be the ones that are doing that less complex stuff. But again, they have that value, because by managing well-being, preventing falls and doing all of that good stuff, you then also prevent hospitalisation. So it is about complete investment in social care, and there's a gradation that you could have in the social care sector.
Yeah, it's about creating those better outcomes, isn't it?
Oh, always. Yeah.
For the care receivers, basically.
Yeah.
And what about CareMatch? What's next for CareMatch? What's the future looking like for you?
Take over the world. I mean, still trying to do that. I don't think I'll ever stop. But so we've got communities now. Our platform's working. Everything's ready to just zing. So now it's about getting ourselves out there, building lots of communities, because the idea is then we'll get interlapping, overlapping communities right through the country. And once you've got that, rather than just having support in your care hub from the community, communities have support from 2 or 3 or 4 communities around them. So I create this very interconnected community care world that can help anybody. If I'm a provider that needs a carer, you could find one, because there'll be a CareMatch community. If I'm a care home that needs a carer, you can find one, because I belong to a CareMatch community. But most importantly, if I'm an individual at home who needs a carer, you can find one. There's a CareMatch community.
I love the sound of that, and I'd love to chat to you again in another 12 months and see exactly where CareMatch is, because it sounds fantastic.
Thank you. Well, hopefully one day.
Well, at the end of every episode, we ask everybody to describe their what the HealthTech moment. So this is a bit of fun. We know people have got lots of weird and wonderful stories, emotional stories from their time in the industry. So Anne-Marie, what's your what the HealthTech moment that you'd like to share with us?
Okay, so we've spoken a lot about CareMatch, and there was a lot riding on this, in that I had to prove self-sustaining communities worked, and that people could self-manage, and that the care hub worked, and all of these great ideas that, well, I'm saying they're great, but I believe they were great ideas, would work. And we had just started, and very fortunately we had a local authority that had gone there with us, and they'd given us a cohort of hours and clients, and we built the community, and off we went. And it was New Year's Day, so probably about 5 weeks after we'd actually set up our first community. And I had a daughter of a client phone me, furious, and she said, "You've missed my dad's call last night, and this is New Year's Eve. And what I haven't told you is this lady was actually a CQC inspector. So this is a heart-stopping moment for me on New Year's Eve, not New Year's Day." So I said, "Gosh," I said, I'm really sorry. Do you want to just talk me through this?" And she said, "Well, Dad called my sister, she was very cross, who was at a New Year's Eve party herself, and said his carer hadn't turned up." So I said, "So what happened?" She said, "Well, she posted in the care hub, and Mel said he'd be there." So I said, "Oh, okay. Did Mel turn up?" She said, "Yes, yes, yes." And I said, "And does Dad know Mel?" "Yes, he loves Mel. In fact, he turned up with a crumble, and you know." And I said, "And how late was the call?" And she said 7 minutes. And then the phone went silent I let it stay silent for a bit. She went silent. And then I just said, "Do you know, I think that's a result. I mean, 7 minutes." She said, "Actually, Anne-Marie, that's quite good, isn't it?" I said, "It just proves to me that the system worked." And I said, I knew all about this, by the way. And I said, "And actually, Mel stayed with Dad and saw the new year in with a glass of sherry." She said, "Yeah, I know, he does that." And he took a crumble because he was a great foodie. And you know, they had a good evening, didn't they? She said, "Yeah." Anyway, I said, "Look, this is a pilot. You don't have to be part of it. I'm very happy for you to phone the local authority and say you want to be withdrawn." "No, why would I do that?" But that was the moment for me that you just think, okay, this can work. And with the right people and the right technology, we can get this right.
Oh, that's a lovely end to a great podcast. So I'm gonna leave it there, because I think that's the perfect end. So thank you so much for joining us this week, Anne-Marie. I've really enjoyed chatting to you, and thank you to everybody for listening. Join us again next week for another new episode. Don't forget to rate and subscribe. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.